Hi, I'm Gabriella McCarty, nurse practitioner at North Shore Gastroenterology, a large private practice in the Cleveland, Ohio area. And I'm here to talk about some fatty liver today and some common liver misconceptions. So what I see all the time, I see fatty liver in my office all the time, even if patients are coming in to see me for other things like GERD or even colon screenings. Oftentimes they do have metabolic syndrome, or I find some old imaging that shows fatty liver. So one of the things my patients always say is, and we know this is a silent disease, patients don't have symptoms, but they say, I don't drink alcohol at all, so there can't be anything wrong with my liver. Where in fact, MASLD, or metabolic associated steatotic liver disease, is the most common cause of liver disease worldwide. Risk factors include obesity, diabetes, hyperlipidemia, hypertension. So you do not have to drink alcohol to have MASLD, which then can lead to MASH and fibrosis of your liver and eventually cirrhosis. One other misconception is if, my liver enzymes are normal, that means my liver is healthy. When in fact, most people with advanced fibrosis or cirrhosis, they actually have a normal AST, ALT. Liver markers are not sensitive markers of liver damage or in isolation. So we need definitely imaging or other non-invasive tests such as FibroScan or ELF testing to see actually what is going on with the liver. It's not just the enzymes. Another common misconception, patients think that if they do a liver detox or a liver cleanse, that is all that they need for their liver to be A-OK, where in fact, most of these detox products are not regulated. They're not approved by the FDA. And in fact, some can be harmful. Another point that patients bring up a lot to me is, yes, my primary care told me that fatty liver is harmless. I just need to lose weight and I don't have to worry about fatty liver. But in fact, fatty liver can lead to fibrosis or scarring in the liver. It can lead to cirrhosis and even hepatocellular carcinoma or liver cancer. So every stage should be taken seriously, and a patient should be educated on lifestyle changes and diet and what they can do to help themselves. So liver disease always causes symptoms. That's another common misconception, whereas this is really a silent diagnosis. So most of the time, patients don't develop any symptoms due to their liver until they already have late stage cirrhosis. So by that time, it is a little bit late. Once you have cirrhosis or advanced fibrosis, it's much harder for the liver to regress. It's pretty scarred. It's not going to go backwards, a little too late. And last but not least, one of the common misconceptions is that only older people get liver disease, when in fact, young adults and children, since obesity is on the rise and so is type 2 diabetes, fatty liver and liver disease is very common in the younger population as well. Thank you so much for listening.